Hello, Dr. Miaken Zeigler. Welcome to our movement of the month. We are talking about cervical range of motion, a core spinal hygiene movement to train your spine and to train how you carry yourself and your posture. So when you're doing cervical ranges of motion, I always want you standing. I want you grounded. I want you to have some awareness at your feet or at your base. And the reason we're focusing on ranges of motion of the cervical spine is because everything in our world pulls us forward, pulls us into this fetal and forward flexed position. When we're here, the input into our brain is a stress input, and we experience the world very differently. So with cervical spine range of motion, we want to open things up and reinforce and train our body to be there. Okay, so focusing on rotation, again, you're always standing, so you're grounded, you're aware of your base. Secondly, you're going to lift your chest, go into a power stance. Then you're going to drop your shoulders back and down. Okay, arms. I never want your arms across in pockets. I want them either at your side or for an added difficulty. You're going to internally rotate and clasp them behind you. This is going to reinforce extension into the body. From here, you're going to find center. You're going to just rotate to one side and then to the other. Now, a couple things here. I don't want you to move past the point of pain. So you may be pain here. That's where I want you to stop and go back to center and go to your other side. I also want you to move into your full range of motion. So if your full range of motion goes to a 45, you're going to stop there. You're going to go back to the other side. Okay, so what you are doing when you're doing these movements is you're training your brain through 3 different ways. First, you're going to keep your eyes open because we want that sensory input. Your eyes are always tracking the horizon, so that's a really great visual input into your brain. Secondly, it's the proprioceptive input. So those joints moving in the neck are really vital, right? Proprioception is a sixth sense. The reason I know my arm is behind my back is not because I see it or smell it or taste it. It's just I know. So when you move your spine in these ranges of motion, it's giving good proprioceptive input from these joints in the cervical spine to help your brain better process what's going on in the world. And then you've got the vestibular, which are the ears, right? You got ears, vision, and then these proprioception, all taking place with your cervical ranges of motion. Never go past the point of pain. Always go into your full range of motion. And this is a core movement that you will do either for minutes or repetitions, but it's something you should be doing every day, all the time, hundreds of thousands in your lifetime. Okay, so again, real quick, chest up, shoulders back and drop down. Internally rotate your hands, clasp them behind you, and then go into your rotation. Okay, give it a try. I look forward to seeing how you do at the office. Dr. Miaken Zeigler.